Dear friends, thank you very much for joining our webinar today. And now it's my pleasure to introduce our dear former patient Catherine and her lovely son Max. Catherine will share her wonderful history with you.
Hi, my name is Katrina and I'm a 45-year-old woman from Oslo, Norway. Olga asked me to give you a few words about my journey and I'm happy to do so. Well, to start off, I just want to say that I've wanted to be a mom for 20 years. And I always thought that by the time I was 45, I would have the perfect husband and at least 2 or 3 kids. However, life is not easy to just plan out in detail. So life just kind of happens. And there I was, 44 years old, and I did not have any kids. So I did what a lot of other Norwegians do when they're in my situation. We called Denmark, and I did, and I started a process there. However, I did not have any attempts in Denmark, because then I was doing some research on my own, and I found out about this Russian clinic that I have to say I thought it was a little scary, because Russia seems very far away. However, they were holding a seminar. I think it was the next day or something. It was really, really close. One of the closest days, and I signed on for that seminar, and I attended. I think it was October of 2018, and I have to say it was a really good seminar. It was very informative. They really seemed to know what they were talking about. The medical expertise seemed extremely high, and but what triggered me was that everything was done and informed to me like that they were working also a lot with compassion, and they saw you as an individual and knew the struggle that you were having, and that was really important to me. So I signed with the clinic, and I just wanted things to happen really, really quick, because I've been waiting for 20 years. I didn't want to wait one extra minute. So I did all my exams, and I sent all my medical journals to Dr. Alena, and they really wanted to help me as soon as they could. It actually took me 3 trials before I got my little son, who's 2 months old now, and I couldn't be happier. But I also want to give you a little hint that when you are in St. Petersburg, which is a gorgeous city, so it will be an experience of a lifetime. It will be a memory for the rest of your life. Get to know the people in the waiting room, because they are in the same situation as you are. And I have to say, I have now several friends, and I really mean that. I keep in touch on a regular basis, some of them every day actually. Where we've been seeing each other, traveling throughout Scandinavia to meet each other on a regular basis. And to think that my son will have friends that he can grow up with who has the same background as him, that he can talk to when he maybe have questions that he does not want to ask me. So do that. That's my greatest tip. And trust the doctors and the nurses. You will get your own doctor, you will get your own nurse, and your own coordinator. So you always have people you talk to that know your case, that know who you are. It's really good that you have people that you can talk to, that you can get a hold on. And I'm just extremely happy and grateful for the work that they've done. And Dr. Olga, Dr. Alena, and Dr. Alena, and my coordinator, Ala, and my nurse, Katya, they will be forever in my heart. And I can't wait to take my son to St. Petersburg and show him where he was made, actually. Good luck to you, and hope you will achieve your long awaited dream. And the people at the Olga clinic, they are the ones who actually can make it happen for you. And here he is, Mr. Max, the most wonderful guy in town. He is, you know, it turned out that this is going to be my little man, and he's just a bundle of joy. So I wish you all my best of luck, and just go for it. Just do it. You will never regret anything. Say bye. Bye-bye.
Dear Catherine, thank you very much for sharing your wonderful story with us. I'm so happy for you and your lovely Max. And now we start the webinar. First, let me introduce myself. I'm Dr. Alena Egorova, and today I will speak with you about various factors that may affect fertility. But we will focus on lifestyle, diet, and useful supplements that may influence fertility treatment outcomes. We will touch on issues of opportunities we nowadays have that we may use to promote egg, sperm, endometrium good function, and this way reduce the time to a long desired pregnancy within own egg IVF, egg donation, or embryo adoption treatment. So let's talk about optimizing lifestyle, nutrition, efficient supplements to increase success rates in fertility treatment and achieve live births. First, let me introduce you a very simple scheme that's a recipe of a successful pregnancy. It looks simple, however, sometimes it may require a lot of work, both for a patient and a doctor, to optimize each of these components for having a realistic chance for pregnancy. For example, a functional viable embryo is possible when you have sufficient egg and sperm quality. A receptive endometrium is ideally the one that is not the subject to influence of any traumatic factors, or at least the one where the damage effect of traumatic factor is compensated well enough. These two components, a functional embryo and receptive endometrium, lead to a successful embryo implantation when meet together. And later, of course, the embryo needs a friendly environment for successful development till live birth. Let me remind you that the embryo, in fact, is the most powerful among these ingredients, and at least 75% responsible for the outcome of fertility treatment and pregnancy. The embryo viability depends mostly on the egg. The most important factor defining egg quality is the right number of chromosomes in the eggs. Only eggs with a normal number of chromosomes may result in a viable embryo and live birth. The incidence of chromosome abnormalities in eggs and embryos depend on female age. Unfortunately, lifestyle measures and supplements cannot decrease the age-related incidence of numerical chromosomal anomalies in eggs. It will always be that at the age of 35, 1 in 2 blastocysts carries a normal number of chromosomes. And at the age of 41, only 1 in 5 blastocysts carries a normal number of chromosomes. The higher the age of the egg, the higher is the incidence of numerical chromosomal anomalies, and the more eggs and more embryos we need to check to find at least one normal. So, high egg quality means a low incidence of numerical chromosomal anomalies in the eggs. Poor egg quality is a high incidence of numerical chromosomal anomalies in the eggs. But that's interesting that even if the embryo normal for 23 pairs of chromosomes is found, that does not guarantee, unfortunately, the success. So not all embryos that are normal for 23 pairs of chromosomes have the same high chance. Embryo vitality, embryo viability plays a role also. Let's compare these two blastocysts that we see. This is a funny cartoon, but that reflects very well the situation that we have in nature. So both blastocysts have normal number of chromosomes, so they are euploid. But one is strong, it has a lot of cells. So this is blastocyst that the embryologist would grade with AA grading. And another one is a blastocyst BC. So it has lower number of cells, so not so full of energy to survive the implantation journey. So we know that better embryo morphology is associated with better implantation rate, and poor embryo morphology with worse implantation rate. So, do we have any methods that can improve chance for pregnancy? Yes, we do. Unfortunately, we are not able to change the age. We are not able to change the egg reserve. But a healthy lifestyle and supplements may help us to get a higher number of competent eggs within your egg reserve, within your IMH corridor, and get a better function of sperm, and this way have more embryos for PGT-A testing and for usage. Lifestyle and supplements may help to achieve better viability of embryos that are normal for 23 pairs of chromosomes. So we may try to give higher chance to normal embryo, normal for 23 pairs of chromosomes, to survive the implantation journey. We may enhance endometrium receptivity and function for your VIP embryo. Our step-by-step approach started with at least 2.5 months of supplements and lifestyle interventions, and continued by individualized stimulation, PGT-A if necessary, and personalized embryo transfer may help to reduce the number of attempts to a baby and shorten time to pregnancy. Within a step-by-step approach, focusing on every step separately and by improving every step, at least by 10%, we may have already significantly better results. Let's say we are not able, quite often we are not able to get more eggs that we can get within the AMH corridor. If the ovary can produce 3 eggs, it will produce 3 eggs. But what's the usage of these 3 eggs if only 1 is mature out of 3? However, if we manage to get all 3 mature and viable, we already have a good chance to create an embryo. So this egg competence is achieved by a complex of measures that should be carefully thought through by a doctor, and of course that's easier to focus every so when you have every step, it's easier to focus on one step to make it as good as possible before you started to focus on another one. And the lifestyle interventions and supplements may help us within the several steps of step-by-step approach of fertility treatment. They may help us to get higher number of mature, competent eggs within the AMH corridor. They may help to improve fertilization rate, to optimize blastocyst formation rate, so that more eggs are fertilized and go to blastocyst stage. They may improve endometrial receptivity, together with other measures, of course. The endometrium function and supplements are also a part of supportive measures that we recommend after the embryo transfer. So now let me try to explain you how supplements may work. Let me make a little excursus into biology to explain that. You know that our body needs nutrition and oxygen just to live. But the problem is that the basic nutrients like carbohydrates, fats, proteins cannot be used directly by our cells. So they carry a lot of energy, but we cannot take this energy directly from them. So these nutrients should be metabolized, processed in some way, so that our body could get energy from that. And what helps us with this process are the very small particles that are present in our cells, and they are called mitochondria. Interesting fact is that many thousands years ago, when there was just a beginning of evolution process, mitochondria was a very small bacteria that was just swallowed by a bigger cell and managed to survive inside, and even entered a very useful symbiosis with a big cell. Nowadays mitochondria cannot exist if they are outside the cell, so they cannot survive. But within the cell, they are doing quite well and actually help our cells to get energy from basic nutrition very effectively. So mitochondria are the power stations of our body. They are able to utilize, first of all, carbohydrates and fats, so high energy substances, together with oxygen, to produce energy for all processes in our cells. The closest analogy that I imagine is production of petrol, because we know that, for example, our cars cannot use the oil directly. So oil is a high energy substance, but if you try to use it for your car, unlikely it will help your car very much. But the processed oil, the one that became petrol, is already useful. So the same close situation we have with our mitochondria. So it takes carbs and fats, process it, and creates another substance. It's a kind of fuel for our cells. The name of the substance is adenosine triphosphate. To spell it simpler, we call it ATP. So ATP is a molecule. That is the universal fuel for most of the processes that happen in our cells. So every cell in our body needs ATP, and especially high amount of ATP we need to have in our tissues, organs that work actively, brain, muscles, heart, for example, and of course for our eggs, sperm, endometrium cells, we also need a lot of energy, and that is ATP. But there is one issue. About 95% of oxygen that mitochondria use, together with carbs and fats, are metabolized to water and carbon dioxide. But 5% are converted into reactive oxygen species, ROS. These are specific forms of oxygen that enter very, very easily into chemical reactions with all molecules they meet. So reactive oxygen species are aggressive molecules. They easily damage proteins, DNA, and lipids in our cells. But luckily, we have natural antioxidants in cells that prevent damage. And antioxidants are substances that can catch the active oxygen. Reactive oxygen species are bounded very easily, much easier than proteins, fats, and DNA. They are bounded very easily with antioxidants. Some antioxidants are produced by our cells. Some we get from food. And if the production of reactive oxygen species and production and consumption of antioxidants are balanced, we feel okay. So our cells are stable and they survive well. But in case there is imbalance, for example, production of ROS is increased, or there is a lack of antioxidants for some reasons, then we have imbalanced situation, and a number of damages in cell structures may become already dangerous for the cell. The cell also has another system, this is repair system, that is able to heal damaged DNA, lipids, and proteins, but the power of the system is also limited. So if the damage is too strong, the cell may even not survive or lose its function. Various factors, for example, environmental toxins, obesity, smoking. I'm sorry, I need a little bit of refreshment. So environmental toxins, obesity, smoking, insufficient amount of antioxidants, and food may lead to antioxidant ROS disbalance, and thus increase number of damages in DNA and in other cell structures, including mitochondria. So how does it relate to fertility? First, of course, all these processes, production of ROS, antioxidant bounding of ROS, do exist in every cell and in our oocytes, sperms, and endometrium either, of course. But the influence of these processes on different cells is different. For example, let's compare the roles of oocytes and sperms in embryo development. This picture shows just the way how differently they even look like. So us oocyte, especially mature oocyte, is a giant cell with a lot of nutrients, proteins, DNA repair substances in its cytoplasm, and with a lot of mitochondria. The oocyte needs this mitochondria as the first 5 days of embryo development. The embryo will get mitochondria only from an oocyte, so no new mitochondria will be created in the first 5 days of embryo development till the blastocyst stage. While the sperm brings no cytoplasm, that means no mitochondria, into embryo, and it only brings DNA. Luckily, the competent oocyte is able to restore not only its own DNA if it's damaged by any factor, but also the sperm's DNA. And a little bit more facts about oocyte and its role in reproduction. The chromosome division is a very energy-consuming process. Let's imagine 46 pairs should divide evenly, and that requires, of course, a lot of energy. Fertilization process, the embryo development, so quick in the first 5 days and after day 5, of course, requires a lot of energy. Where to get it? The oocyte gets it from mitochondria. And resting oocyte contains about 6,000 of mitochondria. In the process of growth, this number increases to up to 300,000. Just imagine. And to compare, a heart cell contains about 10,000 of mitochondria. I made this comparison on purpose because heart cell is one of the cells in our body that requires a lot of energy either. So heart should work hardly every second. But just compare how much more energy needs an oocyte to provide the embryo in the first 5 days with energy. Of course, the more mitochondria, the more energy, but the more free radicals, the more reactive oxygen species are produced. So oocytes needs a lot of antioxidants either. And the lack of antioxidants may affect oocyte even more than any other cell in our body. And of course, oocyte needs a hormonal stimulation to grow. The critical period for oocyte quality is the 25 days before fertilization. This is a time that oocyte needs to mature inside the follicle from dormant to pre-ovulatory stage. The sperm also does play a role. We just discussed that luckily, even if a function of sperm is not optimal, oocyte can give a lot of compensation to that. But still, of course, the better function of sperm we have, the better structure of DNA the sperm gives to egg, the less work it gives to the egg, to restore the possible damages. So, of course, having a better sperm function may help oocyte and future embryo. The sperm production takes about 75 days. And the two critical periods in sperm production are the first several days of sperm production when progenitor cells that will produce sperms have meiosis, they divide their chromosomes, they multiply quickly. After that, there is quite a long, about 70 days period, when sperms are just sitting in the testicles and get mature. Within this time, they mainly use internal sources of nutrition, and testicular tissue kind of protects the sperm from environmental influence. But the last days, when mature sperms already move from testicles to semen canals, are also some critical ones, because there is no protection by testicular tissue anymore. And for example, DNA fragmentation, DNA damage may happen much more easily with this kind of sperms. And what about endometrium? Of course, endometrium is important also. This is the tissue that is renewable every month, and this is good for us, because every cycle we have opportunity to get a little bit different endometrium, maybe a little bit better than the previous. While growing, endometrium needs sufficient hormonal stimulation, different growth factors, micronutrients, and of course the quickly growing cells of endometrium, quickly multiplying cells, need energy, and they need antioxidant Ross balance. That the endometrium actively grows the first 2 weeks of a cycle, and after that, that does not grow anymore, but becomes surrounding environment for an embryo for all time of pregnancy, throughout the pregnancy. So, can we help with something to endometrium which is already created when pregnancy is already achieved? Not very much, but if we support endometrium development before pregnancy comes, we can support the future pregnancy significantly. That's also one of the reasons why not only the eggs and the sperms need support several months before we use them, but also endometrium needs that. So, what we can do with supplements to help our eggs, sperms, and endometrium? We may support the mitochondria by feeding them with balanced nutrition, giving them enough energy resources, by balanced diet, for example, by giving some additional antioxidants. We may maintain good blood circulation. We may balance antioxidant Ross ratio to reduce cell damages. Of course, the less damage, the less burden for repair systems of a cell, the more energy to survive. And that's very important also to optimize hormonal balance, hormonal environment for oocyte, sperm, and endometrium development. So, let us compare the situation that we have nowadays with the one that our ancestors had. Our grandparents ate much less sugar and cereals than we do nowadays. They ate much more fresh plants and fish that contain natural antioxidants. They were much more physically active. They were exposed to almost no environmental toxins and spent a lot of time outdoors. So that means that they had much better antioxidant Ross balance, much less damaging factors, much more repairing systems, so much more antioxidants, and that was positive for their fertility. Spending a lot of time outdoors, they had much higher level of vitamin D in blood, for example, which, as we will speak later, is important for fertility. And finally, they had children earlier. So we know how powerful is the age influence on fertility. And first, we'll speak about the lifestyle. So can we influence with the lifestyle interventions anyhow the chances? Yes, we can. Yes, but I have to say that fortunately the majority of our European patients pay enough attention to a healthy lifestyle and take care of their health so well through a balanced diet and regular physical activity. And they also avoid such harmful factors as smoking, excessive alcohol consumption, that we could even afford to offer programs with live birth guarantee for women up to about they 50 years old. But the individual situation is different, of course, in every patient. Some may have just started to find their own way in improvement of a lifestyle. Some may be, for example, professional sportsmen, and they have daily trainings. Yes, and to those who need to lose some kilos, improve something in their daily diet, we are always happy to give advice. To those who train a lot, we may support that before embryo transfer, but after embryo transfer, for example, we will give them advice to have less physical activity. Only individual analysis of individual combination of different factors that a patient may have in its life, of dietary preferences, of supplements that the patient take, health parameters may help us to work out the best individual scenario for a patient. What do we know now? We know that overweight can affect negatively oocyte, sperm, and endometrium function. And the influence is more significant with higher BMI, especially BMI 30 and higher. We recommend to reduce the body weight, but even reduction by 7–10% before the start of fertility treatment, before egg collection or before embryo transfer, already gives significant improvement. Diet. If we speak about losing weight, there is no preferences in any type of a diet. The more important is just to have lower number of calories per day. But it was shown in some studies that Mediterranean diet, that's, as you know, is based on consumption of a lot of fish, seed products, fresh fruits, vegetables, both for overweight and normal body patients, if started 3–6 months before fertility treatment, may help to improve IVF outcomes. Physical activity in women is positively associated with pregnancy rate. Also, it's important to say for both overweight and normal body weight. In men, it's positively associated with sperm concentration, but not the evidence that it does influence IVF outcomes is not found yet. But let me also say that the clever balance in physical activity is also important. Even moderate physical activity is already good for future fertility. Psychological stress. So far, there is no evidence that there is any relation between effect of psychological stress and IVF outcomes. Speaking about habits, it's well known, of course, that smoking directly affects sex, sperm, and endometrium, and that affects in both female and male smoking. So even if female partner does not smoke, but male does, the chances for success will be lower. So with alcohol and caffeine, there is not so clear effect. First, for example, alcohol is a natural metabolite. So it can be created in our body by nature, but of course in high concentrations it may be toxic for our cells. As about caffeine, there are no clear effects described of how caffeine can influence oocyte, sperm, or endometrium function. So far we know that, for example, low to moderate intakes of alcohol and caffeine in the year prior to infertility treatment initiation do not have any adverse effect on outcomes of fertility treatment. But let me say again that the balance seems to be important. Of course, excessive alcohol and caffeine consumption probably may affect in some ways the fertility, but there is no evidence that like standard consumption can do it. But let me also say that what's important, is that we have a very clear evidence that there is no safe alcohol level for period of pregnancy. There is no safe consumption. So as soon as pregnancy comes, the alcohol consumption is not recommended. So let's talk about supplements. I will speak today about several of them. There may be more, of course, that theoretically can be used in fertility, but I will speak about the most well-studied and popular. Folic acid. The natural forms of folic acid that are called natural folates are present in many plants, peanuts, liver, but the problem is that natural folates destroy very quickly while storage and cooking. Now we have supplements that contain synthetic folic acid. That's more stable form, but that is not used by our body directly. In our body, it transforms into methylfolate. And methylfolate is a substance that is important for DNA synthesis. So that's why folate deficiency is harmful for actively dividing cells. For example, the embryo. Methylfolate together with vitamin B also decrease homocysteine level. So folates positively can influence oocyte maturation and embryo viability through DNA structure improvement. That was shown that folate plus zinc administration improved the sperm concentration and morphology. However, the beneficial effects on fertility remains to be established. This is what about men. But for women, it was shown that women undergoing IVF treatments with higher levels of folate have a higher chance of clinical pregnancy. Also, folate deficiency in pregnant women is associated with a high risk of malformations, especially neural tube malformations, and higher risk of hyperhomocysteinemia. That means higher level of homocysteine in blood. Homocysteine is a substance that can increase blood coagulation, blood clotting, and through this way increase the risk of miscarriage and pregnancy complications. So we may conclude that folate supplementing, folic acid supplementing can be useful, first of all, for women who plan pregnancy, and it's advisable to start folate supplementation about 2-3 months before planning a pregnancy. First of all, before planning the embryo transfer, but also before planning egg collection. That may also be helpful. And folate can be also useful for men to improve their sperm parameters. Omega-3 fatty acids. Omega-3 are special fatty acids that cannot be created by our body. We get them only from food. The main and well-known products that contain a high concentration of omega-3 are fish, sea products, but also some nuts, seeds also give us these useful substances. However, even if we eat a lot of fish and seeds, still we may need some supplementation with omega-3. So there are right now a lot of supplements that contain pure omega-3 fatty acids. Omega-3 fatty acids can become components of the cell membranes and influence cell function. They are very important for cell-to-cell communication. So for every cells, including eggs, sperm, and endometrium. They also have quite significant antioxidant activity, so reduce cell damages. And additionally, they can decrease platelet segregation and through this improve blood circulation. And also they can relax small blood vessels, and microcirculation does improve. These are the ways how they may influence oocyte function and fertilization rate. So they may improve the function of cell membrane, for example, both on sperm and egg. And additionally work as antioxidants and decrease the damages in our cells. It was shown that omega-3 supplementation can improve sperm motility and morphology. They influence endometrium structure positively, and if started, but this is for the second trimester of pregnancy, of course, it's a little bit outside the topic of our webinar today, but I think this fact is interesting because this is also very well studied effect. If they are recommended starting from the second trimester, they are shown to maintain optimal brain function in the fetus. So who may benefit with omega-3 administration? Those who are going to have egg collection in the nearest 3 months, and those who are going to have embryo transfer. Vitamin D. We mentioned it already several slides before. The role of vitamin D is a vitamin that maintains normal calcium metabolism, that maintains absorption of calcium by our bones, is very well studied. But in recent time, that was found that our ovaries, testicles, and endometrium and placenta cells also have receptors to vitamin D. It's not studied well yet what are the mechanisms that influence ovarian, testicle, and endometrium function through vitamin D. But it was shown that women who have sufficient vitamin D levels have better IVF outcomes, both in own-egg IVF and egg donation treatment. And mainly, it was shown that vitamin D affects in a positive way endometrium function. So, having a good vitamin D level is important for all patients who are going to have embryo transfer in the nearest few months. And vitamin D also can maintain good placenta function. So this is the reason why, for example, we advise vitamin D supplementation also after the embryo transfer. And as about the sperm, there is an evidence for a favorable effect of vitamin D supplementation in men. Vitamin D can influence on semen parameters, mainly concentration, and it also influenced positively the concentration of testosterone in men's blood. Coenzyme Q10. So this is, I would say, energizer for our body. That's interesting that coenzyme Q10 is a substance that is normally produced quite actively by our mitochondria. Mitochondria need coenzyme to create ATP, together with many other substances, of course, yes, but this is one of the enzymes that is involved in the ATP creation. And together with that role, coenzyme also an active antioxidant. So it both helps in the mitochondria to produce energy and protects mitochondria. Unfortunately, with aging and while exposure to different damaging factors, mitochondria coenzyme synthesis decreases. So coenzyme and mitochondria function are studied very actively now in so the role of mitochondria and coenzyme synthesis are studied very actively in aging theories, in aging studies. What about fertility? That was shown that coenzyme Q10 supplementation probably through both enhancing mitochondria function in oocyte, first of all, and through its antioxidant effect, can help to improve oocyte maturation and embryo development. That may improve ovarian response to stimulation and success rates. And also that may play a positive role in the treatment of astenozoospermia. This is a condition when the sperm motility is decreased. So probably also through its energizing effect on sperm. The next one is melatonin. Again, first, the melatonin was known as a substance that is produced first by our pineal gland, and this is a substance that's involved in our light-dark cycle. So melatonin is only released at night, and this is a substance, a hormone that helps us to fall asleep when it's dark, when it's getting dark. So that regulates our day and night biological rhythms via its receptors in the brain. But not only day and night rhythms, but actually it's involved in the regulation of many rhythmical processes in our body, like for example menstrual cycle rhythms. But as it was shown, melatonin also has a very strong antioxidant activity. So it is very active scavenger of reactive oxidative oxygen species. Melatonin, through its antioxidant activity, is able to improve oocyte maturation. That was shown that it may lead to higher number of retrieved oocytes, I would say competent oocytes. The better proportion of mature oocytes was found, and better embryo morphology. The effect of melatonin on endometrium is not well studied yet in humans, but so far we already have some positive findings that were done with some animal studies. The influence of melatonin of sperm is not studied well yet, but in theory that may play a positive role as an antioxidant. And myo-inositol. This is also called vitamin B8. We have different food sources of myo-inositol, and this is one of the main substances that provide conducting between signals from hormones to the cells. So this is a messenger that give a signal from a receptor that interacts with hormone to the cell. And that's involved into signaling pathways of insulin, gonadotropin, LH, FSH, as you see, all the hormones that are related to fertility. And with this way, it may even increase the number of ovulatory cycles in case of menstrual disorder, for example. But now we, of course, focus more on fertility treatment. And when that was shown that myo-inositol can give a positive effect on oocyte maturation through better reaction of ovary to the hormones, can improve response to ovarian stimulation, fertilization rates, may improve embryo morphology and clinical pregnancy rate. And also myo-inositol gives positive effect on sperm concentration and motility. So, as you may see, we have many different supplements in our hands. But let me say that that's important, that if one just starts taking all of them with the aim to improve fertility, not necessarily it will lead to a positive result. The individualized, carefully thought through composition of different lifestyle interventions like physical activity, diet, and supplements gives the best effect. To our patients, we recommend first a doctor to analyze the individual medical situation, because just as example, for example, myo-inositol is highly recommended to patients who may have some menstrual cycle dysregulation, for example, those who are having PCOS. Melatonin may be useful for those who are overweight. Folic acid may be useful for every patient, but only the individually given combination of several supplements will give the best effect in your individual situation. So, your individual composition of supplements is recommended to be started around 2.5 months prior to your egg collection and sperm collection or embryo transfer, and in fact they can influence positively every step of the fertility treatment. Let's look at this scheme that describes briefly, the steps in the treatment and which things exactly the supplements may influence positively. Within the step 1, the stimulation, we can improve the chance to have enough competent eggs. The growing blastocyst morphology. And let me note that the approach with making, of course, the individually designed optimal stimulation with individually created list of supplements. This approach we use both for own egg IVF patients and for the donors, because of course we use the same principle in all treatment cycles. Within the step 2, when we are already focusing on preparation of endometrium, the supplements may influence, of course, endometrium receptivity and function together with other measures. The step 3, embryo transfer, implantation, the viability of embryo that depends on previous steps, and possibility of endometrium to accept embryo well, and step 4, further embryo development, also can be influenced positively by giving some supplementation. So the best way we can help you is to assess individually your unique personal situation and work out the best supplementation, lifestyle, treatment approach for you. Let me welcome you for having a personal Skype consultations with our leading doctors. To have a consultation, we ask you to fill in the questionnaire with a summary of your medical history, make an ultrasound examination, or send us the result of examination that's not older than 6 months. Please film the video of the screen of the ultrasound machine and send us video, maybe pictures, and report. And for those who are under 44 and considering IVF with own eggs, we ask to perform a blood test for AMH. If you have journals that describe your previous fertility treatments, any laboratory tests that were done before in relation to your previous treatment, please send them to us, preferably in PDF format, so that we can copy paste and Google Translate. All your questions about today's topic and others are very welcome, and me together with Dr. Olga will be happy to answer them on the 1st of June at 6 p.m. CEST via our Insta Live session. Please ask your questions to get answers which may help you to shorten time to pregnancy and achieve live birth. You're welcome to join us on the 1st of June. And now let me wish you a successful treatment, becoming happy parents as quick as possible. And today I wish you a nice evening.